what to do if your baby has diarrhoea. Now, this is something that is hitting my home quite closely right now. It seems to be a bug that's just going around. How can we stop this gastro bug regenerating and being passed around within our families?
Okay, when we talk about diarrhoea, the key thing is we need to A, stop it from spreading, and B, manage our fluids and manage hydration so that our kids don't dehydrate and then need to get taken off to hospital.
Yes.
So the key thing when it comes to stopping diarrhoea from spreading is hands. We have to wash our hands. We have to be really vigilant with soap and warm water and those alcohol hand gels and all those sorts of things that keep our hands clean.
I feel like I am, like we
and
religiously
you probably are
washing hands.
But every other kid out there probably isn't. I have a little joke that until kids are 18, they can't be relied upon to wash their hands consistently every single time. So keeping your hands clean is absolutely key in terms of stopping the spread.
Yes.
When we're talking about diarrhoea in super young bubs, the first thing that we need to do is maintain their hydration. So keep an eye on their output of wet nappies.
Yeah.
If they're getting any less, if their nappies are less than half of what they'd normally produce, or if they're less than half of what wet they would normally be, then we need to be supplementing fluid. So that can be your infant rehydration solutions. And for a super young bub, there's nothing wrong with a syringe and 5 mils of fluid every little squirt.
The hydrolytes?
That's exactly right.
They're safe?
You can even get a version called Pedialyte, which is a kids-specific version. And that's what they use in all the hospitals as well for rehydration.
So it's so important to keep our babies hydrated. So important to keep your babies... Because they're just losing all the fluids.
Well, you can dehydrate so quickly when you're a baby because you're so small. When kids get older, sometimes they can respond really well to utilising things like the hydrolyte icy poles or even just your standard fruit icy poles. You can't suck down an icy pole fast enough to vomit, to vomit it back up again. And then that will keep the fluid going through and making sure that you're replacing what you've lost.
Is there any other alternatives that mums can use if they're not wanting to, give their children hydrolyte or something like that? Is it just keeping the fluids? Water, is that?
Water is great. Things like ginger-based foods, so dilute ginger beer can be a useful thing. Absolutely. And things like infants' probiotics and even children's probiotics are, again, really useful for helping the gut to recover from that illness that it's experiencing.
I'm so glad you said that because I do give my children some probiotics.
Awesome.
Just to replace what they are not eating. They're being fussy and whatnot, so I try and encourage good gut health. That's the way to go. And wash our hands.